Hello and welcome to the final video in this series on managing back pain in the workplace. Previous videos have focused on the prevention and management of back pain, but of course, sometimes more help is needed. So this video is to help you understand when you might need further help and who should you go see. So when to seek help, I would recommend seeking individualized care under the following circumstances. I can really think of about 4 that apply. Firstly, if you have a tendency to worry and catastrophize. So as we've learned in previous videos, these psychological and emotional factors, stresses, can significantly worsen the back pain experience. So if you are someone who tends to worry or become overly anxious, you don't need to suffer in silence. There are people who are willing and able to help you. The second condition is if you have pain that has lasted for more than about 4 days without any sign of improvement. So of course, getting a bit of a tight back, sore back, a bit of a niggle in the back isn't the end of the world. It's part of the human experience. However, those general niggles that we get if we help a friend move house or push ourselves too hard in the gym, something like that, they tend to get better in about 2 to 3 days, generally speaking. So if you do have a niggle that just seems to be persisting past about 4 days or so, it's probably best to have it looked at because there may be something a little bit more significant going on. Thirdly, if you have had recurrent incidences of back pain, and this one's really, really important. So I would describe that as 3 or more similar painful episodes. It's very tempting to separate these things and think, oh, this one's due to this or this one's due to this. However, in most cases, if you have recurrent incidences of back pain, they tend to be somewhat related, and it's probably worth having that underlying cause looked at professionally. And finally, a bit more of a rare one, but an important one, if you have higher level challenge or higher level athletic goals. So, if you want to run a marathon or enter a powerlifting competition or something like that, the greater the challenge, the more our back needs to be functioning at its best. So if you do have those high level athletic goals, probably best not to let those niggles run untreated. So that's when you should seek care. The second question is, who should you go see? There is a bit of a problem in musculoskeletal care in that it hasn't really been consolidated. So everyone knows if you have a toothache or a sore tooth, you go see a dentist. However, if you have a backache or back pain, who do you go see? The pathway to recovery isn't quite as clear. There are lots of options out there of people willing to help you. However, the main clinical musculoskeletal practitioners and your first line of care for back pain are physiotherapists, osteopaths, and chiropractors. And these practitioners are fully trained to assess your condition and help you to manage it. Now, people often ask, well, what's the difference? What's the difference between a physio or a chiro or an osteo? I have no idea. Generally, in my experience, we're more similar than we are different, and we are all doing similar things to reach towards the same goal. However, if you do want a little bit more advice on differentiation, on who you might enjoy seeing, chiropractors tend to be more manipulative based, so think clicking and popping your back into place. Osteopaths tend to be more gentle manual therapy and advice based, so they'll do more gentle manipulations or soft tissue work on your back and give you advice on how to manage it with your lifestyle. And physiotherapists like myself tend to be a bit more movement therapy and exercise based. However, in my opinion, all good practitioners should offer you, or at least should be able to offer you, some mix of those 3 elements of care. So firstly, some sort of manual therapy, some sort of hands-on, in-the-moment treatment, some sort of education and advice on how to manage your condition, and finally, some sort of exercise homework, something you can do between sessions to facilitate your recovery. Really importantly, when you go to a consultation, 5 questions need to be answered. What's wrong? Can it improve and be fixed? What can the therapist do to help you? What can you, the patient, do for yourself? And finally, how long approximately will it take to resolve? Now, this final answer might not be definitive, but they should give you some idea, and it should be finite. If a practitioner tells you you need to come see them every month for the rest of your life, there's probably something a little bit fishy going on. If your therapist can answer these questions, you are most likely in safe hands. Woohoo! So that's when to seek treatment and who you should go see. I'm just going to finish by giving you a summary of the best practices, covering everything in brief that we've covered in the last few videos. So, to avoid a back injury, you need to integrate those general healthy practices into your lifestyle. Regular movement and exercise practice, avoiding stress, and of course hydration that we talked about. And then integrating those general healthy practices into your workspace, avoiding static postures for too long, and setting up your workstation appropriately. That's to avoid a back injury. If you already have experienced a back injury or are experiencing back pain currently, firstly, don't panic, it can and will get better. Don't fall into those back pain traps, which is avoiding complete rest. You don't want to rely on manipulation and manual therapy unless it helps to get you moving, and you want to control the pain appropriately. And finally, seek help when it is needed, particularly if you're experiencing pain for more than about 4 days and in recurrent cases of back pain. That brings us to the end of this series of videos. I hope you found the information useful, and thank you very much for listening.